Hey, I'm Yuri Al-Kaim, a New York Times, Wall Street Journal, and USA Today best-selling author of the All-Day Energy Diet. And today I'd like to talk to you about 7 unmistakable signs of diabetes. Now, before we get into those signs of diabetes, let me talk about the normal process of blood sugar and insulin response. And then it'll all make a lot more sense when we look at how it kind of just goes by the wayside. So normally when you eat a food, predominantly a carbohydrate, that carbohydrate is digested and broken down into small glucose molecules in your digestive tract. That glucose then is absorbed into your bloodstream and normally increases your blood sugar. Now, because your body knows, as you're about to see in this video, that blood sugar and high levels is very dangerous, it produces and secretes a hormone from your pancreas called insulin. Insulin, its main job is to kind of lock and store. So it goes through the bloodstream, it escorts all of the sugar, the excess sugar, out of the blood and stores it in your muscle, liver, and fat cells. That's the normal process. And then your blood sugar is able to kind of maintain a normal level. And we'll talk about what those normal levels are in just a few minutes. So that's the normal process. But with diabetes, something happens. And the main problem with diabetes is that your body, your cells, stop responding to insulin. It's almost as if somebody's cold calling you all the time and you eventually stop answering the phone. Or if you have, some kind of marketer or Jehovah's Witness who knocks at your door all the time, eventually you just stop answering the door. The same thing happens in your body. Pretty much with any hormone that is constantly elevated, your cells become desensitized to that hormone. In our discussion here with respect to insulin, if you have high insulin all the time as a result of having too much blood sugar, as a result of eating a lot of sugary foods, then your body eventually just stops responding to insulin. And that's called insulin resistance, and that's basically the first step, or the kind of penultimate step to diabetes. So let's look at these 7 unmistakable steps, or the 7 unmistakable signs, of diabetes. And with these, you should be able to identify right off the bat whether or not this is going to be a problem for you. So first of all, the first 3 I'm going to group together in an acronym called HUT, H-U-T. They stand for increased hunger, increased urination, and increased thirst. The first one, increased hunger. Why do diabetics get hungry, excessively hungry? Well, it goes back to blood sugar. So normally, as I said, when you eat, your blood sugar goes up, right? Insulin is secreted to take the blood sugar, bring it down, and move it out, right? So it moves it into your cells. And when that happens, there are hormones, for instance, like leptin, which signal to your brain, hey, I'm full, we don't need any more food. But what happens with diabetes is that because insulin resistance is present, your cells are not getting the glucose coming into them, and therefore they're not signaling to your brain that there is any food coming into your body. So your blood sugar is very high, but your brain is not getting the message. So you end up wanting to eat more food. So that's the first sign. The second one is urination, increased urination. What happens with diabetes is that when your blood sugar is too high, your kidneys are not able to reabsorb the sugar and thus water back into the body. So what ends up happening is that there's increased pressure in the blood vessels and through the kidneys, and what ends up happening is that your kidneys end up excreting a lot more water in your urine. So that's why if you have diabetes, you probably are urinating very frequently, much more so than normal. And again, these are kind of outside of other conditions like drinking huge amounts of water or stuff like that. The third sign is increased thirst. So this ties hand in hand with the urination, because if you're peeing away a lot of your water, then naturally you're going to get thirstier, right? Once again, your body is not able to reabsorb water properly because of the amount of sugar in your blood, which is creating a high osmotic pressure, which I'm not going to get too scientific here, but basically does not allow you to reabsorb water properly. So you end up getting rid of a lot of it, and therefore you have cotton mouth and dry lips, and again, more so than if you exercised in heat and sweat profusely, right? So that's kind of an extraneous condition. So those are the first 3 signs of diabetes. The fourth one is blurred vision. So why would we get blurred vision with diabetes? Well, again, it comes down to blood sugar. If our blood sugar is too high, what ends up happening is we get a swelling of the lens of our eye. So the lens is kind of like the lens, like the front part of our eye. There's swelling that occurs there, again, as a result of the pressure from the high amount of sugar in the blood. Now, if this persists over time, what can end up happening is something called diabetic retinopathy, which is very problematic, which is actually the #1 cause of blindness in America. Isn't that crazy? And I mean, it's no surprise when you consider that there's the proportion of Americans that are diabetic now is staggering, and it's only getting worse unless we take action today to put this to rest. So diabetic retinopathy occurs because the blood vessels in the retina become damaged. Again, as a result of the high blood sugar and the increased pressure in those blood vessels, you're not able to see properly. And that can happen over time. So it progresses from blurred vision to full-on blindness in some cases. So the next sign, the fifth sign, is something similar to retinopathy, but actually deals more with the nerves. And this is called neuropathy, or diabetic neuropathy. And typically this happens most commonly in the feet and legs. So why would this happen? Well, again, high blood sugar damages your nerves. It damages your nerve fibers. And specifically in the feet and legs, typically because gravity is pulling everything down, right? So that tends to be where things happen a little more frequently with respect to blood sugar and this diabetic neuropathy. So if you have tingling or numbness in your feet, or you can't feel, you don't have that tactile sensation you used to, you definitely want to check with your doctor about that, okay? Now, the sixth sign of diabetes is reduced ability to heal wounds or bruising. So you have kind of a lowered ability to wound heal. And why would this happen? Well, again, it all comes back to blood sugar, right? So if you have too much blood sugar, too high of a blood sugar consistently, that stiffens your arteries. It stiffens the blood vessels, and as a result, they become less permeable to oxygen and nutrients. So when you kind of bruise yourself, when you get like a bruise or a cut, oxygen and nutrients leave the bloodstream. They actually kind of perfuse out of the blood vessels and into the wound to heal it. But if the blood vessels are too stiff and they're not permeable to allow that to happen, well, then you're not going to be able to heal your wounds or bruises properly. So that's why you might have a bruise that stays around for days or maybe even weeks instead of taking 1 or 2 days to heal. Now, I've talked a lot about blood sugar being, the big issue. So let's talk about the specific numbers you want to be looking for, and that's our seventh sign of diabetes. If you go to your doctor and your doctor does, there's typically two tests, or two common tests that are done. The first one is a straight up blood sugar test, or a blood glucose test. So if you go to your doctor's office in the morning, typically they'll have you fast overnight, so you just go to bed, you don't eat anything, right? You wake up in the morning, you don't have any breakfast, you go to your doctor's office, and they will take blood from you, okay? Then they're gonna look at what is the amount of sugar in the blood, and if it's a certain number, well, I'll give you that number, if it's over 126 milligrams per deciliter, then you are classified as having type 2 diabetes. Okay, so the normal range, just to give you some reference, is 70 to 100 milligrams per deciliter in most normal healthy individuals. Normally after we eat, it goes up, and because in a normal healthy body, insulin is able to take that sugar and bring it into the cells, and the cells take it in and they respond to insulin properly, the blood sugar comes back down. Again, staying within that 70 to 100 range. But in diabetes, the blood sugar stays elevated because insulin is not responding, where the cells are not responding to insulin, so therefore the sugar must stay in the blood because it can't go inside the cells, right? So that is the first test that your doctor might have you do. The other thing you might do is an oral glucose tolerance test. Try saying that 10 times fast. This is something I did actually when I was in university, and I was a guinea pig for one of these diabetes studies. So here, again, you would fast overnight, and you'd go to the clinic in the morning, and they would give you a sugary drink, and in this case I was drinking Ensure, which is just a crappy meal replacement shake, and we did these finger prick samples. So with this test, what you're looking at is if your blood sugar is higher than 200 milligrams per deciliter after 2 hours of this sugary drink, then you would be classified as having type 2 diabetes. Okay, so those are two different blood kind of tests you can do typically at a clinic with your doctor, and those previous 6 signs are things that you can probably just recognize yourself on a day-to-day basis. So if you recognize any of those signs, the first 6 certainly, by all means, check with your doctor. Say, hey, listen, you know, I'm experiencing this, this, and this. What does this mean? I think we should maybe do a blood test to check things out. And if it does so happen that you do have diabetes, then it's not the end of the world. I mean, it can be if it persists and you don't do anything about it. But I'm here to tell you that diabetes is actually a very encouraging disease because it's very reversible through exercise and diet alone. Now, I've actually got a special report that will show you how to start kind of turning the clock back and reversing this whole problem. It's called the diabetes debacle, and you can get it. It's at the link below this video or somewhere on this video. And it's a free report, totally yours for free, and it's going to illustrates and kind of bring to your attention a lot of the things that your doctors won't even tell you about diabetes. So it's very important information, and especially considering that, you know, a huge proportion of the world population, not just the American population, is developing diabetes. This is a big problem that we want solved as soon as possible. So I hope this video finds you well. I hope you're going to get a lot of value out of this. And remember, just to leave you with one final little piece of advice. When I talked about exercise, okay, exercise is the safer alternative to getting insulin injections. Okay, so what I mean by that is that the studies show, and physiologically this is what happens, when you exercise, especially at a higher intensity, it does exactly what insulin does at the cellular level. But here's the cool thing, you don't require insulin to get sugar into the muscle cells with exercise. So when you exercise at a good intensity, and it could be something as simple as watching this video and contracting all of your muscles very intensely, that is going to stimulate your muscles to move specific transporters to the cell membrane. And that's going to literally kind of like open a door and bring sugar into your cells. So exercise is massively important for helping you reverse and prevent diabetes. And if you want more amazing tips, then be sure to grab the Defeating Diabetes, the Diabetes Debacle free report that I have for you, again, at the link below this video. So thank you so much for joining me. I hope you've enjoyed these 7 unmistakable signs of diabetes. And again, never forget, this is something that you can completely reverse without pharmaceutical intervention. So I hope this finds you well. I'm Yuri Elkaim, and I look forward to seeing you on the healthier side. Again, you can subscribe to my channel and grab your free report below. Talk to you soon.